Good afternoon, everybody. This is something I don't know a lot about, and we've sampled the last 3 years, and I can still say I don't know much about. But I'll explain all that in a minute. I do want to say, so the Water Survey is part of the Prairie Research Institute. We used to be part of DNR in Illinois. We're 130 years old this year. We're a sister agency to our State Geological Survey and Natural History Survey. We were moved into the U of I in 2008 because someone felt like that must be a better place for us to be. We still have state mandates, but we're not considered a state agency anymore, so it's kind of interesting. There's a lot of people to thank. All the names on the left are folks that I've leaned on in the last 3 years, and some I still, like Braden. I lean on him a lot because he knows a lot about Legionella at New York Department of Health. Some of these names you'll see during my talk today, but all have provided information, like Mara Donahue from US EPA. I was looking at research papers related to Legionella. She's at ORD, I think, still, hopefully, in Cincinnati. And so I just cold called her, and she's provided a ton of great information about issues with some of the methods. The folks on the right are our staff at the Water Survey. Sally, Aaron, and Sarah are here. They help sample or been working on some of the state work we're doing, looking at what the state intakes forms are, and I'll talk about that too. Natalie and Will actually worked for me a few years ago and started some of these efforts. So the Water Survey, I mentioned, it's 135 years old. We were starting in 1895 because of cholera and typhoid outbreaks. You see this slide a lot if you do or participate in any of our webinars, and I realize that, but it's a great place to work, and I'll explain why that is. We run the whole gamut. We have monitoring well networks that have been around since the 50s. We've been able to do outreach and education like the private well class and wateroperator.org. We also do a lot of research. We've done groundwater modeling. We do climate, hydraulic, fate, and transport modeling. All of these things. I've involved a lot of arsenic research related to sand and gravel aquifers in Illinois for about 10 years. And so it's been an opportunity, as well as answer requests, both from communities, engineering firms, and the public related to private wells and private well issues. And so that's what the survey's based on. We have about 120 staff in total, and was 6 sections. Now they've narrowed that down to 4. But we house the state's well logs. All the county health departments provide the logs to us. They only have to keep them for 10 years, which is a really stupid law, but at least we have all those along with our state geological survey. And so we monitor everything in the state. So a lot of researchers from other places come to us because of the data sets that we have, which is a really cool advantage. The reason we got into Legionella is because someone asked in one of our webinars. In February of 21, at the end of one of our presentations, I didn't mention Legionella. Somebody just asked the question, is Legionella a concern for homes and private wells? And that's a good question. Because of our water operator program and our work with small communities, I just said, and everything that I've done has been related to cooling towers, small communities, and community-related systems where there's just not any information that I'm really aware of about private wells. And so whoever was on the webinar, put this in the chat, check out this journal. There's a paper by Kay Mapley and others from Virginia Tech. And so it got us to thinking. We looked at this. It was 44 homes in North Carolina. A little over, close to 20% were positive, or 16% were positive. They use IDEX Legionella, which is a liquid culture method for detecting Legionella pneumophila. And they took cold and hot water samples, and they confirm a PCR. And so that's a fair amount of Legionella. So the issues here, before I go any further, IDEX Legionella is a rapid, or it's a more, it's going to find it more readily than the CDC culture method. The plate method that CDC uses and most labs have to meet for regulatory compliance, because the culture method, it has to be at a higher level in order to actually show up on a plate. But there are 60 species of Legionella. Legionella pneumophila is only one. There are 15 serogroups of Legionella pneumophila. For reference, there's only one rapid test. That's what doctors use in a hospital. When somebody comes in, it looks like pneumonia. They do a rapid test that only detects serogroup 1. So what they're doing in hospitals only detects one serogroup of one species, And so whenever folks say that Legionella pneumophila is the only one you need to worry about, it's because no one, to my opinion, no one's really looking for all the others. So, but when we read this paper, realizing that private wells are not disinfected, chlorine is the way to kill pneumophila, it's a bacteria. There's hardly any research out there. The only research I could really find on private wells was right after Legionella was discovered in 1976. And through about 1982 or so, there were studies where they actually sampled the well, not in the home. So Legionella is a bacteria that you inhale, it gets in your lungs, you could drink it all day. It won't make you sick. But the other side of that is it doesn't necessarily make you sick. You need to have some risk factors, usually people over 50, immunocompromised, lung issues, things like that. So most risk communication information, like during the pandemic, like what ASDWA put out. Everybody knows who ASDWA is, the Association of State Drinking Water Administrators? Okay. There's one sentence at the end of their information about private wells. No one considers it a risk. And then on the NIH's website, 96% of all the documented cases are considered community acquired. So the difference between an outbreak and a community acquired means an outbreak is more than one hit, if you will, more than one case that can be linked. So 96% of all the cases every year can't be linked to each other by any factors. Like if you have an outbreak at a nursing home or a veteran's home, that's an outbreak. So there's 10,000 cases a year of Legionella in the country. 9,600, they don't have any idea how they were acquired. And most of those are not investigated. I won't say all, a few states may do some of that, but in general, outbreaks are the only thing that are investigated. So in the end, nobody really knows where all these Legionella cases come from every year, which was kind of startling. And because private wells aren't disinfected, it was a little bit of a worry. So I'm coming at this as trying to answer the person's question. And what I wanted to learn was what can I tell a well owner to do to protect themselves from Legionella? And that should be a pretty straightforward thing. It's actually turned out not to be. It's kind of complicated. But Kelsey Piper, who was at Virginia Tech and now at Northeastern, although now she's at North Carolina State? Is that where she went? Oh, Charlotte. Okay, yeah. She was part of that paper, so I reached out to her. We've known each other since she was a USDA fellow at Virginia Tech many years ago. And she said, you should talk to William Rhodes at Virginia Tech. He's been doing a lot more of this work. Reached out to William. He just took a job in Switzerland to work with a Legionella researcher in Switzerland, which really put us at time difference odds and things like that. But he introduced us to New York and New Jersey's state health departments, as well as the Southern Nevada Health District, which all had their own little work group looking at Legionella issues, and they all welcomed me in. And this was in 21. I picked their brains for years. But we've stayed together loosely and had a number of calls and talked about different issues as we've gone along. And what it led to was we did a Legionella workshop in January. The private well class hosted it. It was virtual, but they all had a chance to give a presentation as well as the one I did, which reminds me, how many of you were on that webinar? Okay, so I'll tell you right now that this is basically the same talk. There's a little bit more at the end, a little bit new. So we were planning to have 12 lightning talks, and we ended up with only 7. So we threw this in at the end. So it wasn't planned that I was going to give this today. So that's where, yeah. So bear with. But those folks have been really instrumental in, I'll call my journey in learning about Legionella, which has been really frustrating. And I'm coming at this also as an arsenic researcher. If it's above 10, you tell people it's a risk. If it's below 10, then it's okay, right? That's the standard. We generally tell private well owners, I guess in some states it's not 10, it is in Illinois, but what we generally tell well owners is we follow what the US EPA recommends for community water supplies, equal protection under the law. And even though there are no laws for private well owners, that's the best advice I think we should give. And so that's where we're coming from. And so the first thing I wanted to know was, what do states ask on their Legionella forms? It's a reportable disease. They have to have an intake form and a lab form and all those things. Every state does a little bit differently. And so what I first had the folks do is start calling the states and try to get copies of their forms to see who asked what your water source is. So actually 2 states do. It's not New York, it's Wisconsin and Georgia. Georgia wouldn't give us the data. We haven't went back to FOIA that or any of those things. But in Wisconsin, 30% of their samples, or their hits, or their Legionella cases, or Legionnosis cases, were not on municipal water. That's typically going to be a private well. That is a lot. And so we were working with New York, and we told them what we were doing. They actually, like Braden and the folks in their group, asked their compliance folks for Legionella if they would add it to their form, and they have. This data, though, came from when we first started working with them. They have really great information for their water system boundaries, and they have all their cases in GIS. So they were able to just create a 2-layer map, tell us what percent were within a municipal water boundary. 13% were not, and we're assuming most of those are going to be private wells. So either way, that's a fair amount of homes or people who've gotten sick if it's from their home water system. There's also travel and hotels and all those things. But that's the gist of where we started. So Sarah Manderbach is working with us now. She started last September. She's finishing that work up. We've got almost all the state intake forms. We're going to try in the next few months to get a paper out that provides kind of an ideal form, talks about which states are lacking some questions and which states have really great questions, not naming states, but here's what we think should be asked, including, to me it's a win already that New York added water source to their form, and we want every state to do that. So we also decided to sample. I have some internal funds. We also have the institutional water treatment program, sorry. Since 1947, the Water Survey has sampled all the state buildings, prisons, the State House, all those things for water quality, mostly for corrosion control and scale formation. So they're looking at optimizing those things. Well, they added Ledge Alert, 8 or 10 years ago. So they're, at the time, CDC actually certified for Ledge Alert. They don't anymore because there's problems with Ledge Alert that I'll get into. But when we were first getting into this, they're certified. They're using this method. We should just use it. So we found 60 homes because one of my colleagues, Dr. Walt Kelly, who was my boss, they got a CDC Healthy Homes grant, or HUD Healthy Homes grant, and they were sampling 150 homes in Illinois for lead. Big study. They even actually remediated some homes by changing out all their pipes, which it's a cool study to be able to do that. But we asked if we could use their mailing list, basically. And so we found 60 homeowners who were willing to let us collect samples. And because this was a small internally funded thing, we sent them kits with the return label. They shipped it back to us. So they collected the samples. And we tried to give them really good, what we thought, sample instructions. Legionella has a 28-hour holding time. So I think that's right. Yeah. So what we found, we had 57 homes in the end, 3 didn't return them. 44 did, all 3 hits, or all 3 samples. So when we talked to our work group and to William, he was like, everybody had a different approach to how we should sample. You need to sample 6 places in a home. Well, we weren't going to do that. So what we chose where you're most likely to get it would be in your shower. You're inhaling hot water, right, or steam. So we asked people if they had a spigot, a bathtub sink combination to collect it there. If not, we wanted to use the least use sink in the home, most likely to have stagnant water for a longer time. And so, and we decided to collect first draw when it first gets warm and when it first gets hot, all from the hot water line. So the first sample's cold because the water's been sitting there overnight. And so we've been consistent with that throughout. And so to be positive, it just had to have one of those 3 samples positive at a home. So we had 23% positive and 77% negative. So we learned after the testing that Ledge Alert is a questionable method because there are other bacteria, especially if there's a lot of them, that can cause it to turn color. Because it's a colorimetric, it's a liquid culture method, it turns tan. Pseudomonas will turn it kind of a greenish color. We didn't know that until after we were already done. I went back to our lab analyst. He's like, yeah, I think a couple of them were kind of different, but all that's gone. He never made notes, so we had no idea what was and what wasn't. And so that was a little frustrating. And then Mara Donahue from EPA gave me a lot of good information about some of those issues. And there's a number of bacteria that are common in groundwater that can make that go positive. So depending on how much bacteria there are, it can really cloud things. And I know Emily mentioned earlier, if you have a whole bunch of bacteria, it can really challenge even the culture method because it's going to basically take over those plates. And that's what we're learning. We did not confirm a PCR because I didn't know any better, which we've done since. So I also talked to some professors on campus who were doing a little bit of Legionella work in schools. They brought up this term VBNC Legionella, viable but not culturable. So what I learned by looking at the literature is that Legionella can go into a kind of a dormant state where it won't culture, but eventually it can reconstitute and cause legionosis. So how do you find it then? Yeah, it's a pesky bug is the bottom line. So they said that they could determine if it was VBNC Legionella. So we went to a private lab for culture the second year, because I was obviously down on Ledge Alert if we learned that some of those samples probably were not Legionella or Legionella, and I told the homeowners they were. Then we did this VBNC work with qPCR and this PMA stain, which you can determine by taking 2 samples using PCR. The stain samples, the stain can get into a dead cell or a broken cell. It can't get into a live cell, and you can, in theory, tell the difference and quantify it that way. So we collected these results, all the samples for the PCRs, which, the PCR analysis is DNA. Live or dead, it's going to show up. So it's not great from a health perspective, because sometimes you may sample and have 85% have PCR positives. That means there might be some Legionella DNA in your water sample. It doesn't mean there's viable Legionella that can cause any kind of disease. So we sampled the first year. We did have the second year, we did have 3 samples positive from, it was Special Pathogens Lab in Pittsburgh, and there were 3 different species. None of them were Legionella pneumophilus serogroup 1, which is what everyone assumes is 90-some% of all the cases. So we had this blue-white species. It was grouped in a group of 5, and this rubicillins. And so we weren't sure what to make of all that. So we started asking more questions, and we looked at the data together from 22 and 23, because we tried to sample the same homes. 45 of the 57 were, but none of them matched up. Only 1 culture sample was Ledge Alert positive. None had all 3 sets positive. And 2 of the 3 culture samples were negative. I'm learning as we go, as what's going on. So what we learned, though, after the fact, is that PMA is basically not considered a viable method to determine VBNC Legionella. There is no science consensus on a way to determine VBNC Legionella. So we kind of went down the wrong path. And actually, I really felt like we wasted a lot of time and some money, because we should have never looked at that when we were still trying to answer the basic question: what can we tell well owners? The methods, even the Ledge Alert method, isn't consistent, all these problems. So I went back to all the folks that I'd worked with and talked to, try to get more advice. And so we were planning to what we could do in 24. Some issues, though, that you need to realize how different it is, in my head anyway. There's no MCL. There's no way to evaluate risk. Even low numbers can cause it in immunocompromised people. If you breathe it in, it doesn't take much. Some people can breathe in a whole bunch of it and they don't get sick. So evaluating how that's going to affect things is really difficult. And again, pneumophila is considered all the cases. I was at NEHA last year, and a former state epidemiologist from a state health department told me we shouldn't even be looking at anything but pneumophila. Nothing else matters. And yet we haven't found pneumophila serogroup 1 in any of our samples. And I mentioned the rapid test. It's only looking for serogroup 1. We're still looking at this from a public health perspective, trying to determine what can I tell people that's consistent. And really the 2 things, Legionella lives and grows, well, it lives very heartily, but it grows from 86 to 120 degrees. So a lot of the advice is keep your water heater above 124. Some states don't even allow you to do that. They have rules that say it has to be 120 or less, especially for like a nursing home or things like that. So then if you want to keep it hotter, you have to use a thermostatic mixing valve. And so that led to some of those things. We actually used New Jersey's form that they hand out with the letters we sent out to our residents afterward. And so it's kind of a mess. There's no standard way to do this. And then we also learned at the same time that the CDC's culture method, that's the gold standard, unless you have, oh boy, what's the number now? I want to say, unless you have at least 10 CFU per milliliter, it's not going to, 10,000 CFU per liter. It may not culture. So, and what we're finding, it's positive PCR and it's negative. Well, it's just, you have to have enough of it or it's not going to culture. The other methods don't really give you what you need to know. So again, I felt like it was a kind of a waste, 23, and so we went back and went to the work group. So we decided we'd sample with all three methods at once. We would collect the samples, not have the homeowners do it, because that was a concern a lot of people had we talked to. You're letting the homeowners do this. Are they really following the rules? Are they always doing everything the right way? And then we had talked about an additional analysis method that became available that New York shared with us. And so our plan was just to pick 20 or 30 participants in 24, as many as we could that were already in the other 2 years. We would collect the samples. We'd use all three methods. We wanted to send it to one lab and have them do the split themselves instead of us splitting the sample. There was this triplex PCR testing that had become available through Eurofins that was supposed to be able to use PCR to help determine species and differentiate serogroup 1 Legionella pneumophila. And then we also, what I wanted to do was find out what the other bacteria were. That was really the thing that bothered me the most. If all these Legionella positives aren't Legionella, what are they? Well, I couldn't find a commercial lab that would take the final cell contents from the Legionella work and would go put that in culture with the ISO method to tell me what bacteria were there. And so then we learned right before we were going to start testing that the triplex PCR, the company, Eurofins, had stopped offering that. And again, I couldn't find a lab to do the Legionella confirmations. And that's all changed now, but at the time, that's where we were at. So we weren't sure what we were going to do, and then the money I had ended July 1, 2024. And with delays because we were going to a different lab and getting through the U of I with all of they had to be added as a vendor, and that took 2 weeks and all these things. I was out of town the last 2 weeks of June. So Sally and Aaron, part of our team, did all the sampling on themselves in 9 days. But we collected 3 500 milliliter bottles. We sent it to Eurofins. They split it in the lab. They did PCR, Legionella, and the CDC method. And so I thought we'd have problems with homeowners letting us in their homes. We had no issues with that. So, but the results ended up being just as inconsistent. There's a lot here. Hopefully you can tell the color differences. Man, it's so different. I used yellow and orange. Hopefully those show up that way. But I sorted them. I'm colorblind, so that makes things even more interesting. And there's light blue over there, which, one screen's better than the other. It's showing that. I'm sorry about that. But I sorted these by, so there's, what do we got here? Yeah, so the yellow are the CDC culture method. The middle are the PCR, and the first ones are the Legionella. No, that's not right. I have it backwards. The first one is PCR. The middle one is Legionella. And then the third one is what we found using the ISO method from CDC. So we had 5 homes that had detectable Legionella. They actually, a few of those, they couldn't even figure out what species it was. They even sent it to their lab in New Jersey, which uses MALDI TOF, which MADLI TOF is a French company, developed this other method, and they still couldn't determine what it was. But again, we found Anissa, we found other Legionella because they couldn't differentiate it, and we found the one that had Legionella pneumophila serogroup 5. They reported as 2 to 15. They don't differentiate, but it's not Legionella serogroup 1. But the real problem here is in the middle, that's what I sorted this Excel file by. You see these values growing in the first draw. I've had folks tell me that the first draw should be the highest amount because there's more likely biofilms growing in the end of people's taps. But it was all over the map. Many of the PCR samples were negative otherwise, and some of the PCR negatives were positive for ledge alert. Well, you can't have positive Legionella in a ledge alert sample if PCR says there's no Legionella in the sample. It's, again, that's the DNA test. If there's any at all, it's going to show up. 5 minutes? 4 minutes. Oh, I might have to be the one who cheats here. Yeah, so anyway, in the end, the problem was that, let me go, I'm just going to go forward. So the good news was the one that was 2 through 15 this time was serogroup 5 of the year before, same home. The blue-white species before was Anissa, which is one of those blue-white species, and the 4 that were ISO positive using the CDC culture method were also PCR positive. That's all consistent. But 33 of the ledge alert samples, of those 33 that were positive, 21 were PCR negative. That's 60-some%. That can't be. So one of two things is happening. Either the lab doesn't know what they're doing, or there's a lot of other bacteria causing those ledge alert samples to go positive. But what we've been told in the past is that others who've looked at this, maybe 10% of the ledge alert samples are false positives, and there's some other bacteria. We got 63%. So it really makes me wonder, what are we looking at? I'm not sure we know, but it sounds like there's a lot of other bacteria in these water samples, and maybe we've just stumbled on that, I'm not sure. So we still have all these questions, 64%. And what do I tell a well owner? Keep your water heater above 140? Well, I've learned from other folks that if you do that, you create a whole different atmosphere for bacteria that cause other bacteria to be more prevalent in your hot water heater and your water samples. So we're changing the bacteria possibly. So really the only advice I can give them is to use continuous chlorine. And that's really what I tell people today. So, and there's studies that show even, it's supposed to kill it, like the standard methods say that at 160 degrees, you kill Legionella in an hour. There's plenty of research out there that shows after much longer than that, it's still alive or it can be reconstituted. So yeah, it's a real problem. I mentioned the 10 CFU per milliliter. CDC sent samples to all their elite labs. They found that when it's above 10 CFU per milliliter, they were correct 85% of the time, but below that, 93% of the positive samples they sent out were incorrectly identified as negative. So if we're working with low levels of Legionella, we don't even have a method that's going to tell us what's going on, and that's where we're at. It's really frustrating. So yeah. There's a lot of variability. I've been told that even because the method has flexibility in it, 2 different analysts may get different results because they may do one thing different during the standard methodology to analyze those samples. So what do? And then one of the things that they ask you to do with a culture method is to use acid and heat to get some of the other bacteria off the top of the culture before you actually look for Legionella. Another lab told me that they stopped doing that because they found in their own investigations that they lost 60% of the positives by doing that. So what I'm learning is it's the state of the science for Legionella determination that's really the problem here. And I'm not sure what to do about it, but since we're gonna get our funding, and I probably will try to sample again this year. Here's some of the other things we learned. I'm gonna go just a couple minutes over. Sorry, I cheat. Yeah. Because I haven't done research like this for a number of years, and it's really got to me. We had someone tell us, no, I just mean, if I'd have known how much trouble this was going to be and how poor the science is and how difficult it's going to be to actually have any answers for a well owner, I probably would have walked away from day one because I'm still not sure what we're going to do, but we're certainly trying to make a dent and work with a lot of people and at least bring attention to this. So one person told me, ignore all other species. If it's not Legionella pneumophila, it doesn't matter. The same person told me you should just go to one lab. If you go to 2 labs, you're going to get different results. Now, how is that? So we're going to send them to 3 labs, and we're going to report it, however it is, because that's what people need to know. I'd never heard any of this. I don't know how many of you have. The using acid thing I mentioned, as much as 60%. I'd recommend raising temperatures in a water heater, not doing that. I mentioned that already too. But we know Pseudomonas, and there's 4 or 5 other bacteria that can cause false positives. I have found a lab that's willing to do those cultures of the Leg alert positives, so that's what we hope to do. So currently, Sarah's working on this paper, looking at all the state intake forms. We've been reviewing Legionella papers for the last 3 years, and she's been cataloging all that information, so hopefully we can at least provide some good information there. And we do plan to sample hopefully in August. The other method is MALDI-TOF. By happenstance, we found out our vet med school at the U of I has one. And one of the people at ISTC, one of our sister agencies, used to use it. So we may get to do that. It may not cost us hardly anything to use this other method in order to confirm what we're finding. So we're going to try to do that. And the triplex PCR that went away is now back. So we're going to try to do all those things. So that's it. I'm around all week, the rest of the time, obviously, so we can do that some other time. Thanks for your time. And I'll also say I hope to run long so I didn't have to answer any questions, because I really don't have any, so.